Good afternoon, everybody. Thanks very much indeed for joining this Greater Manchester briefing following our emergency committee meeting earlier today. I'm joined on the call today by Sir Richard Leese, who will update you in a moment on the latest case information for Greater Manchester, and also by Councillor Sean Fielding, leader of Oldham Council, and David Molyneux, Councillor David Molyneux, leader of Wigan Council. So Sean and David will both speak to you before I sum up and we open up to your questions. So thanks again for joining us, and I'll hand straight over to Sir Richard Leese.
Thanks, Andy, and good afternoon, everybody. Just before I go into the numbers, a very short preamble. We've always said that we want to have responses to COVID-19 that are evidence-led, that are proportional. And as the evidence changes, then clearly we will change our response to that evidence. And I think that's going to be very clear in some of the things we have to say. The table on incidents is up, and everybody should be able to see that. You'll see across Greater Manchester that there is virtually no change from one week to the next. But within Greater Manchester, there have been a number of changes. For 5 of the districts, the incidence has gone up, and for 5 of the districts the incidence has gone down. The only one that is still in the red category is Oldham. The only 2 that are in green on incidence are Wigan, and now as a result of coming down, Stockport's moved from amber into green. If we look beyond those figures and look at the other measures that we use, and I usually talk about these. One is the Pillar 2 positivity position. For this week, for Pillar 2 positivity, that is a number of tests that are carried out that are coming up positive. All 10 districts are now green as far as positivity is concerned. A final measure that we've talked about regularly is that of people seeking 111 triages for COVID-19 symptoms, and that number has been low for a number of weeks, and there's been virtually no change between last week and this week on that number. A couple of things where there have been changes. If we look at the 7-day average of hospital admissions for COVID-19, they again have halved over the last week from 2.6 to 1.3. If we look at the number of people who are in intensive care across the entirety of Greater Manchester for COVID-19, that is now 14 cases. The totality of non-ICU cases has gone down from 71 cases in hospital to 50 cases in hospital. So admissions down, number of ICU cases down, number of non-ICU cases down, and at a time when total hospital capacity being used has gone up to around about 83%. Final figure I give about the current situation relates to deaths, not a figure that we've given regularly over the last few weeks. And I'll caveat what I'm going to say about this. Clearly, if we've got 1 death from premature causes, then that's 1 death too many. In the last 7 days, there were 15 deaths recorded as coming from COVID-19. But I think to put that within some sort of context, if you go back to the last week of April, the week ending 30th of April, in that week there were 237 deaths. This is quite a radical change in the way that COVID-19 is impacting on the whole of Greater Manchester. Something I said last week is that people who are testing positive generally have low or no symptoms. They're not contacting a GP, they're not dialing 111, and they're not going to hospital. The age range is still almost entirely under 16. If I just pick out the Manchester number, which clearly there has been an increase, that increase is predominantly in the 20 to 30 age range. So it's a younger age group, and we don't know whether the virus has changed or not, but clearly the impact of the virus has changed over a period of time. I think that has very much coloured the discussion we've had today about how we think we ought to be responding to the virus and how government should be responding to the virus. It is still pandemic. That is, it is still widely spread across the whole of Greater Manchester. So we still need to be taking action to bring the virus under control. There is still a risk, particularly a risk around vulnerable people and shielded people, that if they do come into contact with the virus, it will have a more significant impact on them. And coupled with what might happen through winter, that is an ongoing risk. But at the same time, it's becoming more and more clear that some of the measures that government has imposed, some of the restrictions that have been imposed, are now almost certainly causing more damage than they are saving lives. We have seen over the last few weeks a significant increase in people with mental health issues presenting both through police phone calls and to mental health services, and that's undoubtedly a response to prolonged restrictions on people's lives. The economic situation continues to deteriorate, and we know that being unemployed, long-term unemployed, deprivation is a major impact on people's health and on premature death. We still are nowhere near returning to normal in terms of business as usual within health services. Somewhere like Manchester Foundation Trust would have been doing 2,000 operations a week. They've not been doing that. They've not been seeing outpatients in the numbers they saw previously. That is clearly a significant impact on a lot of people's health. And so I think we are getting to a position, probably past the position, where the actions that are being taken are not proportional. So in general, we would not support any increase of the restrictions that are in place, not just in Oldham, but in anywhere else within Greater Manchester. Some of the restrictions, for example, about businesses operating, casinos, beauty businesses operating in full, I think are now damaging rather than helpful. Certainly the ability to meet in open spaces is something that is not helping either. I think some of the measures, with the exception of Wigan, which David Molyneux will talk about in a minute, some of the measures like not visiting people in their home, continuing to wear masks, continuing to have rules, for example, in bars, restaurants, shops around social distancing, we continue to think are important because the evidence does suggest that those may make a difference. I'll add one thing in terms of the numbers, and this is the issue about proportionality. We'll probably try and get some more data for succeeding weeks, but there will be more people died as a result of smoking in the city of Manchester alone last week than died as a result of COVID-19. So this is not to underestimate the potential impact of what is still a pandemic, but it is to make the case, and we'll be making the case to government, that the way we deal with that pandemic has got to be evidence-based and proportionate. I'll conclude with that.
Thanks very much indeed, Richard. So, colleagues, just to echo the point that Richard made, this is a changed picture we're seeing in Greater Manchester from the one we've presented in the last couple of weeks. If we go back almost 3 weeks ago, we were seeing the rise in cases, which led the government to come to us with a proposal for the restriction on social gatherings in the home. So back in the week ending 25th of July, we had 23 cases per 100,000. That grew to 28 in the week ending 1st of August, and then it grew again to 35 last week. But for the first time, we are now saying that the measures appear to be working. There's been no increase, and actually a very slight reduction over this last 7 days. So it's obviously a picture that gives grounds for cautious optimism that the increases have leveled out. But of course, we will remain extremely vigilant because the case numbers are still quite high in a number of our boroughs. But the borough that's in most progress on the latest figures is Oldham. And I'd like to introduce Councillor Sean Fielding, leader of Oldham Council, to talk about what Oldham has been doing with the full support of the wider Greater Manchester family. And obviously we support the council in not wanting to see a local lockdown in Oldham because of the damage that would cause on many levels. But Sean, I'll hand over to you to talk about the position in Oldham.
Thanks, Andy. And I'm likely to repeat some of the things that both yourself and Sir Richard have said on this issue, but I don't think it will do any harm. As people that are observing this table will be able to see, there has been a decrease in the case numbers in Oldham in the last week, which is really positive. And as a result of the work that we've been doing locally with the support of both colleagues and partners in GM and beyond, we're really grateful of the mutual aid that has come in from other partners and agencies across Greater Manchester and also from beyond too. And we continue to be in regular dialogue about the plans that we have in place and the plans that we're acting upon that have resulted in that decrease, and I believe will result in a further decrease as we move forward. And in doing so, we hope that we're making a really compelling case against the kind of local lockdown that has been spoken about as being a possibility for us in Oldham. So as many people have seen, I've done a number of media appearances this morning talking about my view on what local lockdown would mean and why it's not the right solution to the problem that we have in Oldham and would potentially make things in other ways considerably worse. Now, as Sir Richard said, the case numbers that we're seeing are now focused around the working age population. They are not in the way that they were focused in care settings and amongst older people with pre-existing conditions in the way that we saw in the first wave of the pandemic. And so a lockdown at the style that we used to respond to that first wave would not be the correct solution in Oldham to respond to this second wave, which is quite different. What we're seeing in Oldham is household spread predominantly. We have, as many commentators will know and people observe the situation in Oldham, we have high levels of deprivation in parts of Oldham. We have people working in low-wage employment. We have crowded living conditions in many parts of the borough, and we have multi-generational families living in those crowded living conditions. And those are the places where this virus is being spread. Now, it's not being brought back to those households from people going out for a pint or going out for something to eat or going out to buy a t-shirt in the businesses that had reopened after the lockdown concluded last time. It's because people in those households tend to be those who do the kind of employment that never really shut down in the first lockdown, the kind of employment that brings you into contact with the public quite a lot. So public transport workers, taxi drivers, takeaway delivery drivers, people that work in essential retail. And so they continue to interact with the public during the first lockdown, and we've continued now. And so that is the source of the virus getting into homes, but then it is spreading within homes. And where you have a family of 6 living under the same roof, if somebody comes back from work having contracted the virus, then the other 5 of them are almost certainly going to get it. And that's what we're seeing driving the increase here. Closing down non-essential businesses in Oldham would not change that. It would not solve that problem. I think that the delays to the easement of restrictions that we're asking for in other parts of Greater Manchester in Oldham are the right thing to do under the circumstances. But again, I don't think that the local lockdown in Oldham would be the right thing to do at all. Now, I know that it's happened in Leicester, and there's talk of it happening in other parts of the northwest, not so far from here, but the circumstances of those places are completely different to Oldham. Leicester is a city within what is essentially a quite rural county. It's a discrete area that you can draw a convenient ring around. Oldham is not. Oldham sits within the conurbation of Greater Manchester. I'm sat here in my kitchen in Failsworth, which faces Manchester. Up the road, my residents that live in Chadderton, they face Middleton, which is in Rochdale. And in the other direction, my residents in Hathershaw and Bardsley face Tameside, face Ashton in that direction. There are parts of the borough where one side of the street is Oldham Council and the other side of the street is another council. So a local lockdown under the geographical circumstances that we have here in Greater Manchester and in Oldham would be completely and utterly impractical, aside from being the wrong solution. I don't know how you could make it work, full stop. I think we're completely intertwined as well with the economies of Greater Manchester and the northwest. We have 40,000 people travelling out of Oldham every day to go and work, and 30,000 people travelling in. And the lockdown, a local lockdown in Oldham, would be disastrous for all of those people. And again, would be a disaster inflicted on those people that would not solve the problem. We have a fragile economy in Oldham already. We've not recovered from the first lockdown, but I think it'd be fair to say that really we've not recovered from recessions dating back and the deindustrialisation of the 1980s in Oldham, and so we're still grappling with that. And to inflict a further close down of the economy would be catastrophic for us, and that's why we are resisting it strongly. I think that there has also been chatter online about perhaps closing down discrete parts of the borough, which is even less workable than closing down the borough as a whole in Greater Manchester. And I think that to do so would drive community cohesion issues within the town too. And we're already seeing flaring up of that on social media, and sadly it is spilling out onto the streets. And a local lockdown in Oldham would intensify that and add fuel to those flames, and that is something that we want to avoid. So for a number of reasons, I'm opposed to local lockdown, as you would expect, but I'm happy to concede that there should be no further easements at this time that the rest of Greater Manchester is seeking in my borough. Thanks, Andy.
Thanks very much indeed, Sean. That's a really clear position that you've outlined on behalf of Oldham Council. And the first thing I would say is congratulations to all of your team. Clearly, a lot of hard work has been going on. Thank you to people in Oldham working with the council and others, because there has been a clear shift back in the right direction. Obviously, the challenge now is to sustain that. And just to echo Sean's point, the point we're putting back to the government today is that you cannot look at the figures in isolation and consider the virus aside from the local economy, the social impact of restrictive measures. And hence the need to work with us to get an arrangement that's right for Oldham, and I'll come back to that in summing up. But also at the opposite end of Greater Manchester, we have a borough in a very different position, and therefore I want to invite Councillor David Molyneux to update you on the latest position from Wigan's perspective. David.
Thank you, Andy. I think people can see very clearly from the table about how much different Wigan's position is to the rest of GM. And I'm very pleased and very proud of the residents in the way they've reacted during this current situation that we've had to deal with. I think the restrictions in Wigan were necessary right at the beginning in terms of trying to maintain that figure to a very low level. And although you may see on the end of the report there's a slight increase, that slight increase is down to 5 cases in a care home somewhere in the borough, which is now under control. So that shows consistency in terms of how we've dealt with it in Wigan. And I think there's now a very strong case for the easement of the restrictions in Wigan. And I'm sure the people of Wigan would fully appreciate that. In view of the fact that what we've had to go through over the last 3 months in total throughout the Northwest has been quite testing on people's patience, and I think it's certainly something that we can be proud of in the way that we've reacted to this. I now think there's a very strong case for Wigan in terms of easing the enforcement that we have currently in place, and I think we can make a very strong case to the Minister, not just for the other areas in GM, but specifically for Wigan. And thankfully today we got the full support of the leaders across GM in terms of moving this forward. And I hope to certainly see the easing of restrictions in Wigan, and that will have a big impact on people's lives and certainly on the mental health of a lot of people, and certainly on the business sector. So that is the situation we're now in. We will be making that plea to the Secretary of State, and hopefully he can see what we've already done and what we've already put in place is making a big difference. And that thankfully was fully supported this afternoon. Thank you, Andy.
Thanks very much, David. So just to summarise, I'll be writing to the Health Secretary later this afternoon to set out the Greater Manchester position. And I do it in a constructive way, because we want a dialogue with the government, using our own knowledge of our own communities to get a set of arrangements for Greater Manchester that are right for this place. And in some ways, come back to what Sean said, I'm going back to something I said very much earlier in this crisis, that a local lockdown would be highly problematic in Greater Manchester, and I very much stand by that view for the reasons that that Sean has given today, the interconnected nature of our city region, but also the fragility of the economy in parts of Greater Manchester, particularly the northern boroughs. So for those reasons, we've always had our concerns, but we were prepared to consider the steps that the government raised 3 weeks ago as a way of avoiding a local lockdown. We describe these as modest measures, obviously still having an impact on people's lives, but measures that were a step to prevent what we didn't want to see, which was that local lockdown. And on the figures that Sir Richard has presented today, we would say that those measures have begun to work, and we can see an improvement in the position and an end to the increasing cases that we'd seen in previous weeks. So it is on that basis that we will be going to the government today to say that the measures are working, and we would want to see them remain in place in 9 of our 10 boroughs with the higher number of cases, because obviously we need to keep bringing those figures down further. In the case of Wigan, however, it is clear, I think, the measures have had a preventative impact and have stopped the increase that we've seen in other parts of Greater Manchester. I think we can say that they've worked, but I support David and the council in saying that now at this point, I think it is unfair on people in Wigan to continue those restrictions, given the case numbers at a fairly consistent level, and that's why we'll be asking the Secretary of State to release the Wigan Borough from the Greater Manchester restrictions. However, but to keep them in place for the other 9 boroughs and to keep them under review. What we want to say further is obviously that we will continue to support Oldham with all of the measures that they're taking, the mutual aid that Sean described, and we believe we can say with credibility that the strategy is working. It is highly targeted, it's proportionate, and we believe the case is made to continue what we are doing to see if we can then create a further decrease in the coming days. So there is certainly no case today to impose further restrictions on Oldham beyond the prohibition on social gatherings in the home. What we would reiterate for all of our boroughs is that we need the public to continue to follow those restrictions, as well as the other advice around, of course, hand washing, social distancing. You know, we are still in a very challenging situation. This is by no means a return to normality. We will keep the restrictions under review, but they do need to remain in place in the other 9 boroughs for now. And as I say, without anything extra in Oldham beyond the targeted activity that's taking place on the ground to bring the figures down. But there is just one other issue to raise, which is the issue of the business openings that we delayed last week in Greater Manchester. As Sir Richard said, we've taken a proper look at the evidence with regard to spread, and we don't believe that those businesses are adding to spread in Greater Manchester. So what we'll be saying to the government today is that we would now like those places to be able to open as they have been opening in the rest of the country, and certainly it would include beauty parlours, which we said last week we felt should be allowed to open, but we would now like to broaden that to say we can't see a case for the restrictions, and we'd like the government to give permission for those to open. But here's one caveat: in 9 of our boroughs, what we have agreed with Sean is that in Oldham, I don't think it would be wise at this point to allow those openings to happen. So with that one caveat, we'll also be making that case to the government later today. Just finally to say that, you know, the issue we constantly come back to throughout this crisis is that many of our boroughs have large numbers of people in work where they struggle to self-isolate, and this remains one of the biggest unresolved issues which is hampering not just Greater Manchester's response to this crisis, but the country's response. to this crisis. If people need to self-isolate or are asked to do so by NHS Test and Trace, they should be able to do so immediately without any financial worries. And we're still not in a position where they can do that. NHS Test and Trace head Dido Harding has made this case too. And it's really important that the government listens to her, because we are not going to protect these communities through the coming winter unless that essential support is in place. And we call on the government again to support the call for an immediate arrangement whereby anybody asked to self-isolate can do so and have their pay covered for the 14-day period. So, Ross, I'm going to leave it there. We've outlined the position, I think, pretty much in detail. Hope it's been helpful for colleagues, and we're now happy to take questions.
Thanks, Andy. I'm going to take a round of three. So I'm going to go to Dominic Hughes at the BBC first. He asks, and we'll put these to Sean in the first instance, have you been given any credible indication that a full lockdown for Oldham is coming? Second question is from Michael Gaffney. It is now nearly 3 weeks since the Alexandra Park and Wigan wards of Oldham were identified as COVID hotspots. The situation regarding infections in those two wards hasn't materially improved in that time. Why is that? And finally, from Eunice Muller at BBC Northwest, would you accept a lockdown for Oldham based on postcodes instead of a full lockdown? So I'll put that to Sean in the first instance, and then Andy, if you want to come in on it.
Yeah, I was just noting those down. Apologies for the delay. I didn't know the names of the reporters, so I'm just going to have to. Hopefully, you'll know which question I'm talking about when I respond to them. The first one about whether there's credible evidence that lockdown is a possibility for Oldham. Absolutely, yeah. It's been reported widely in the press, and we've had communication from government that it's something that is genuinely being considered. And it is something that's why we've been prompted into action to make a strong case against it, including all of the media appearances that I've done today, and the plans that our team back in Oldham have been working tirelessly on. And it's almost a frustration that the plans that we want to get on with delivering on in order to bring the infection rate down in the way that we need to, we're not running at full capacity with those, because so much of our time is being spent having arguments with government and others about how we are opposed to local lockdown, and we think that it's the wrong thing. So it is very real. It is a very real threat for Oldham, make no mistake at all. But we are resisting it strongly for all of the reasons that I've set out today and in other places earlier today. In terms of the 3 weeks since we saw the spike in Alexandra Park and Wigan, I don't believe that, although Wigan is the name of a ward, Alexandra Park isn't, and I don't believe that those are referring to electoral wards. I think they're referring to either middle or lower super output areas, so it's a more concentrated area. But of course, 3 weeks, when you become aware of something, it takes some time to come up with a plan that you want to deliver upon. And we know that the incubation period of coronavirus is up to 14 days anyway. That's why all the people that are coming back from France, Spain and the Netherlands are being asked to stay in for 2 weeks. And so to be told about something 3 weeks ago, to pull something together and start responding, it's going to take a bit of time before it starts having an effect. And I would argue that the data that was before you today on the slide that we showed demonstrates that what we have been doing since we got that information is having an effect and bringing the infection rate down. And there is early indication from some, albeit unverified data that we've got, that it is continuing on a downward trend, which is really positive. So we've not stood still. We've not ignored the problem. We've been working incredibly hard with the support of our colleagues from GM and beyond and other partner agencies in order to bring this infection rate down, and it is delivering some results as we've seen today. In terms of the lockdown for Oldham on postcode, I was talking earlier about how the lockdown for Oldham as a borough as a whole is impractical because of how intertwined different boroughs within Greater Manchester are themselves. I think that a lockdown based on postcode or ward level or street level is even more unworkable in that respect. You know, ward boundaries in many ways are often even less logical than borough boundaries. And equally postcode boundaries in the same way. So I think that a postcode-based lockdown would be incredibly difficult and impractical, and again would not be the solution to this. The lockdown of the type that was introduced in Leicester and of the type that has been being talked about for Oldham is not the solution to the problem that we're having with the infection rate climbing, or the infection rate being predominantly amongst the working age population and being spread within households. So that is not the solution. Lockdown, whether it's on a borough level, whether it's on a postcode level, whether it's on a county level or a regional level, is not the solution to the problem that we've got.
Andy, did you want to come in on that one?
Yeah, thanks, Ross. Briefly, just to support Sean in what he said, if a lockdown couldn't be justified in Oldham last week on the evidence, then it certainly can't be justified this week, given the improvement that we've seen. So that would be the first point that I'd be making to the government, but also the wider point that we've all been making today. If you go to some of our less affluent communities, and when you consider that furlough is beginning to come to an end, and other forms of financial support, to put poorer communities under lockdown is a major step for the government to take, and it must be a very, very, very last resort, and all other options must be considered before that is done. All of the steps before that. And that is very much our message today to the government, and to work with us on that. We wouldn't support a sort of postcode lockdown within the borough. That would be highly divisive and very difficult to implement. So what we're saying today is considered. It's based on the evidence of spread as we see it in Greater Manchester. Obviously, the delay on further openings in Oldham is a cautious approach, given the position that the borough is in. But we think that is the right way to go today, and we very much hope the government will listen.
Thanks, Andy. A quick question from James at the Bolton News. How pleased are you that the government scrapped the algorithm procedure in awarding students their grades?
Of course, James, I am pleased, because obviously it had a hugely detrimental impact on Greater Manchester, because many of our young people here are more likely to go to sixth form colleges and FE colleges, and because they were hit hardest by this algorithm, it was a discriminatory system with regard to students in Greater Manchester, totally unjustifiable, and actually frustrating that it took 5 days for the government to listen, and many young people's futures were thrown into doubt as a result of that delay, and maybe some of them now can't go to the university of their choice this year, and they may have to defer. Completely unacceptable. When presented with the evidence on Thursday of the discriminatory nature of this system, the government should have acted immediately, and it is very disappointing that they didn't. But in the end, we have the right outcome. We hope universities now across the country will work to honour the places of young people as much as possible this year, and the government should support the universities financially to make that possible for as many young people as possible. And we need all of the remaining doubt about BTECs to be removed. There are still some people saying to me as recently as yesterday that they haven't received results. Now, I don't know if those results have been provided yet, but really there can't be any other delay with regard to supporting the position of BTEC students and their position with regard to university applications as well. So it's been a really sorry saga, but congratulations to the young people of Greater Manchester who stepped forward, who spoke up and took a stand and made their voice heard, and rightly so. And it was just wonderful to see that one of our colleges, Loreto, saying last night that a number of their students had been able to rightfully claim their places at Oxbridge, previously denied by the algorithm. That's what the campaign was all about, the future of young people in Greater Manchester. And I would just say to all of them, I've just been so impressed with the way they've handled everything. And we all support them now in putting this sorry saga behind them, focusing on their future and fulfilling their potential.
Thanks, Andy. I'm going to take two questions. The first from Michael Gaffney at Heart. We've spoken for consecutive weeks about the lack of compliance with the rules across Greater Manchester. The demands the restrictions are placing on individuals and businesses are only going to increase given the last support payment was made to self-employed people this week and furloughs due to end in a fortnight. On top of that, COVID treatment has improved, mortality has dropped, and there's currently less than 900 people nationally in hospital. So why are we persisting with such onerous limits on people's lives? And also Liam at the Wigan Observer, who specifically has the final say on easing local lockdown restrictions? Is it a local or a government decision?
So Ross, I'll say something, but I think Sir Richard probably should come in on this question as well. From my point of view, I think what you've outlined, Michael, is very much the reasoning that we've been going through. You know, you cannot look at the figures for the virus in isolation of the economic impact that the whole situation is beginning to have, particularly in our poorest boroughs. And the question has to be made, you know, the question has to be asked, if you're to restrict people's lives any further, when, as you say, the other forms of support are coming to an end. In Oldham, Sean said earlier, you know, businesses will not reopen. You will be causing profound damage in places where the economy is at its most fragile. So that's the case that we're making today to the government. Proportionate, targeted, evidence-based interventions, yes, and we will always work with the government on that, as we did when they came to us asking for the restriction on social gatherings. We still believe there's evidence to support that remaining in place in 9 of our boroughs. But we will lose the public if we're not following the evidence here and we're not being proportionate in our responses. And I think that the Wigan decision very much reflects that. I think still it was the right thing to do. I think if we hadn't have done it, I think cases would have risen much more sharply in Wigan. I think, therefore, we can say that it's been successful. But I don't think it's right for us then to sustain restrictions on people a moment longer, really, than they can be justified. And that's why we're making this call on the government to release Wigan from the GM restrictions. It's not our decision, though, to answer that question, Liam. We are just simply, having discussed it myself and the 10 leaders and obviously senior officials across Greater Manchester, we are making our position clear to the government when they make their considerations this week about areas that might be subject to further restrictions or lockdowns. Obviously, there's a government process now whereby they have a series of meetings throughout a week, culminating in the meeting on Thursday, where the final decision is made. And obviously, what we want to do, as I say, in a constructive spirit, is to give the Greater Manchester view. I have to say, this is a unanimous view of myself, the 10 leaders, and all of those senior officers who were on the call today. And given that level of unanimity, I very much hope the government will listen.
Thanks, Andy. Richard, do you want to come
in? Please. Thanks for the question, Michael. I think it's worth repeating something Andy said earlier, is that we very much want to work with government on this, because although the nature of the problem has changed, there is still a problem, and we still need to do what we can to reduce the level of that problem. So I was said in the past that the action that government took 3 weeks ago, we supported that action, although we did not support the way that they did it, because they imposed rather than working with us, and we want to try and move to a position where they are working with us. A lot of this I covered in the introduction, and it's really to, I think, agree with much of the underlying content of your question, and it is about balance and proportionality. Because of the way that the virus is impacting on Greater Manchester at the moment, and people aren't going to hospital, they're not going to their doctors, they're not in general dying in the way they did back in March and April and May, then we do need to start dealing with it differently, when we recognise that if people can't get to work, if the economy is not functioning, if people can't get the treatment they otherwise would have been getting in hospital because of the impact of COVID-19, then that is likely to be having more impact on people's lives than benefit they're getting from the measures to deal with COVID-19. That's not to say we do nothing. Talked about wearing masks, talked about social distancing. In Manchester, over the past 7 days, we've taken action against a bar, a restaurant, and indeed a private home, where behaviour was such that it was likely to unnecessarily people at risk. And we need to continue to do those things. But at the moment, I think our view is that the balance isn't right, and we need to, far from increase the number of restrictions, reduce the level of restrictions to those things that really make a difference. And in Manchester, just like in Oldham, most of the transmission is now in people's homes. Stopping people going to work, stopping people mixing in a safe environment is not going to reduce that risk at all. Let's look at what we know about causes and deal with those causes. And we now know more than we did 3 weeks ago. We ought to act accordingly.
Thanks, Richard. 2 questions for you in the first instance. The first one from Elizabeth Rushton at the Rochdale Observer. Rochdale Council has just announced it's doubling its spending on infection control scheme to ensure specialist staff can continue working with settings like schools and care homes to make sure they're COVID safe. How concerned are you that this financial burden will be replicated across other boroughs as schools are set to return in just a few weeks? And Eunice Muller from BBC North West. Manchester is teetering on the edge of falling into the red alert category for infection rates. It's not a changed picture there. How concerned are you?
Okay, thanks. First of all, Elizabeth, in terms of the financial impact, then I'll be very concerned indeed. Not just in the example you've given, I can give other examples that although government has, for example, stopped providing food support for people who were shielded vulnerable, there are still around about 1,000 people in Manchester alone that we're continuing to provide that support for. All of that is falling upon the local authorities and the voluntary organisations that are helping deliver that. So local authorities are still racking up costs in terms of dealing with COVID-19. No indications whether there is going to be any other financial support coming from central government. But as we've reported collectively through the combined authority, every single local authority in Greater Manchester is looking at an enormous budget problem, some of them this year, all of us next year. So very major concern about that. And we certainly do need more support, continued support from central government in not just managing the issues, but managing the financial implications as well. In terms of the question from Eunice and what's happening in Manchester in particular, in many respects, I could repeat all the things that Sean Fielding said about Oldham earlier, although clearly we've not reached quite the same extent yet. First of all, the nature of the infection is it always goes up before it comes down. That's something I did say last week, and we're very much in that position. It is almost entirely in-home transmission. So cutting out a lot of other things, closing down a lot of other things wouldn't have the required impact. Again, we are doing things like safe door knocking, home visiting, using community champions to talk in particular areas, targeted leafleting, a whole range of measures to get through to people the risks that do exist and the behaviour that we need to see from them in order to reduce that picture. We're also, again, increase the amount of testing we are doing. We've asked government for a number of fixed testing stations as well as the use of the mobile testing stations, because it's always been the case that test, trace, contain, and particularly the backwards tracing is a key element of how we maintain an element of control. So of course, we'll continue to be concerned just the fact that we're in the amber category, never mind that we're moving towards red. But again, we think we have a very clear action plan, 10-point action plan. That's been checked with the Cabinet Office, who were inspecting us last week about the robustness of that. But it is likely to take probably 2 to 3 weeks before we start to see the impact of that coming through.
Thanks, Richard. Andy, bring you in on that one.
I don't think I need to add anything, Ross. Richard's covered it all there.
That's fine. Question from Nigel Barlow. Do you think that the apparent daily publishing and speculation about the number of cases by borough and even more localised figures in certain parts of the media is damaging to Greater Manchester?
I think it's certainly unsettling for people who live here. I mean, obviously, we've been very open always about case numbers, about some of the challenges that we've had. I think constantly speculating about what might be about to happen in Greater Manchester does cause a degree of damage to community confidence. So, I think what we've always said all the way along is, people should stick to the evidence, the facts that we're presenting, rather than getting into speculation, which I don't think is helpful actually at this particular time, because people are fearful. People are worried about their businesses with the various forms of government support coming to an end. This is people's lives actually, and that speculation can have a significant impact on people's mental health. And Richard gave the figures before about the increase in referrals. There's clearly a reason behind that, which is people are struggling with this situation that they're in. And actually those figures should be taken into account as much as the figures for the virus. What is the health impact from some of the restrictions that we're seeing, and particularly therefore some of the speculation that then appears in the media, right? I think what we want from the government is less sort of closed meeting approach to this, in terms of when they're discussing restrictions potentially being given to local areas, and a much more open, iterative process where they kind of enter into a discussion with local areas about what might be needed. This sort of I think it's described as a bronze, silver, gold meeting structure within the working week within Whitehall, I think is potentially adding to the problem here, because it's kind of building speculation through the week about certain communities, and I'm not sure that's helpful. And I think what we need to get to is a much more open exchange of information from a local to a national level, and then an agreement on a proportionate set of interventions, just to kind of have talk of lockdown. And I think this word is problematic, lockdown. That is what we saw in Leicester, but it's not what we've seen in Greater Manchester, yet the two things are being confused. And I think maybe that word itself causes a degree of fear in people. So I think we need to be clear on our language, but I think we need an open process with the government. And this is not just Greater Manchester, I think all communities across the country need this, because the idea that we're all waiting on a Thursday to hear what the government decide to do, is causing damaging speculation. And I think we need a better process than the one we've got.
Thanks, Andy. One question from Adam Clark at Roch Valley Radio. The FA has released new guidance this afternoon that clubs in steps 3 to 6 of non-league can allow 15% of capacity into grounds this coming Saturday. What's your reaction?
Well, thanks, Adam. And I don't know whether David Molyneux might want to say something about this, because I think the Wigan Borough might be affected by some of the FA's changes. What I would say is the FA are going to need to be sensitive to areas where there is a bigger risk of spread. So you can't just say it's 15% at all grounds across the country. I think there has to be a consideration for boroughs that are under further restrictions, or where there's a need for greater caution. So in the same way that we're adopting that approach, I think that evidence-based approach, I think the FA would be well advised to do that too. David, do you want to add?
Thanks, David.
Yeah, I can pick that up, because I think the FA are already interested in doing test events, certainly in Women's Super League. So I think it's important that they get that balance right and make sure that everything's in place to make sure it can be done safely. I think the public actually are craving to attend live sport events, but at the same time we've got to be cautious. We've got to make sure that all the right restrictions are in place in terms of how we deal with that. But I'm sure lower down the football table, people are desperate to get back to some kind of normality, and if it's controlled right and they deal with it right, we'll certainly be able to test things out.
Thanks, David. A question for Sean. from Liz Hull at the Daily Mail. Has anyone from government met with officials from Oldham or visited Oldham in recent days to discuss a possible lockdown?
Yes, the Cabinet Office has actually been in Oldham today and is conducting a visit right now as I'm here talking to you. I also, as a result of the extensive media presence that I had this morning in terms of explaining why I was against local lockdown, had a call directly with the Department for Health and Social Care that went in at the last minute at 11 o'clock this morning to discuss this as a result of the things that I've been saying publicly. There had already been considerable interaction between ourselves and the government though in the run up to that, so it's not fair to say that they were backed into a corner by the things that have been saying in the press. But yes, extensive conversations with government about local lockdown, what it will mean for us if it's imposed, and why we're opposed to it.
Thanks, Sean. A question for Andy in the first instance. Do you think, from Stephen Kingston at the Salford Star, do you think, do you all still think that people shouldn't be able to meet in gardens? No one seems to understand the logic for this. We're hearing that people are just not listening anymore. Also, if 40,000 people are going out of Oldham and 30,000 people are going into Oldham, why is Wigan any different? Do people not go in and out of that town? And James Much at the Bolton News asks, at what 7-day rate would another borough have to fall to for you to ask the Secretary of State to release it from restrictions?
Okay, thanks, Stephen. We made it clear when the restrictions first came in that we felt it was illogical to apply them to the open space that is people's gardens. Obviously, the government didn't go with that, but we still think there is a case for easing the restrictions generally on people in gardens, because obviously there can't really be any evidence that says you can't talk to somebody in your garden, but you can in a park. I mean, we've always said we have a difficulty with that, and I think that is one of the things that has caused some frustration with the public. In terms of why is Wigan any different? Well, Wigan is different in terms of the number of cases. You know, there is a much lower number of cases in the Wigan borough. So if people are going in and out of Wigan, obviously they're less likely to take the infection back to the borough where they are because of the lower number of cases. And people in Wigan shouldn't necessarily be restricted in terms of gatherings they can have in their home because of the low overall number of cases. So it is something that we watch very carefully. I think we do have to be guided by the evidence. I've always said that there is an interconnected way of life in Greater Manchester where people are going across borough boundaries, and that does have to be brought into consideration. I don't think you can look at any borough in isolation. I've always said that. But when presented with the evidence that the cases are in single figures and they're not rising, I think it is right to say, you know, that the patients of the borough of Wigan, people there will be tested, and it's right to make this move. And obviously we would hope to release other boroughs or ask for them to be released in due course. James, in terms of your question, what 7-day rate does it have to fall? Well, the 7-day rate is part of it, but I think another big part of it is the rate of increase. You know, if you are looking at a big increase in a short number of days, regardless of the number of cases, that is something that you have to take into account. So the measures we look at are a broad range of measures, and on all of the measures, I'm pretty certain if not, maybe just one, maybe not, Wigan is currently green. So, you know, it's looking at the evidence in the round, to be honest, and making a balanced judgment on the back of that.
Let's make a quick comment on that.
Thanks, Andy. Richard, do you want to come in on this one?
Yeah, it's on James's question, really, which I agree with everything that Andy said about gardens. It's impossible to explain to anybody, and if you can't give a rational reason for something, people aren't going to do it, are they? And that's what we will see. But I think James's question is a really difficult question when we know that at the moment for COVID-19 there is no vaccine and there is no cure. Is that the question really comes down to is that means it is likely to continue, and at some point we have to decide what is overall our tolerance level for COVID-19 that allows us to go on about our everyday business in an ordinary way whilst we still have COVID-19 around. Now, bearing in mind we are still learning about COVID-19, there is an enormous amount we don't know. Some evidence that the virus is already changing, perhaps even becoming less virulent. But again, it's too early to say that. This is a very difficult question. At some point, and it's a point that will come sooner rather than later, that we have to say wherever it is, that there is a particular rate that we are simply going to have to accept until we get to the position of a vaccine or a cure, because certainly within this country, the chances of eradicating through the sort of measures that we have been taking, I think, are virtually nil.
Thanks, Richard. Bring back Andy.
Sorry, Ross, it was just to reflect a point that came up at the meeting this morning with the leaders. Leader of Stockport Council was pointing to the fact that case numbers now down to 21 per 100,000. Bolton has come down a little as well. Trafford the same. So I think we will very much be wanting to look at boroughs as they continue to come down to also see the easing of these restrictions, and certainly something we will look at again next week. Wigan is clearly in a different position, but other boroughs now are beginning to show decreases, and I think we'll be just to say to the residents in those boroughs, it's not that we're just going to look at Wigan in isolation. We will apply the same approach to all of the 9, and we would want these restrictions removed as quickly as can be done safely.
Thanks, Andy. I think we've got time for just one more question, and it's for Councillor Molyneux from Joseph at the Manchester Evening News. What has Wigan been doing so differently that sets it apart from the rest of Greater Manchester in terms of COVID cases? And does Wigan being such an outlier in GM suggest the borough is not as interconnected to the city region as previously thought?
Thank you for that, Joseph. Yeah, Wigan probably started from a lower base than other boroughs, and so we've maintained that. We're very much connected to the city region. In fact, a lot of people, you only have to try to get on the guided busway some mornings to see how many people travel in and out of the city. So we're certainly connected in that respect. But I'd like to say that our team, certainly in public health and the health professionals in general in Wigan, have worked continuously hard to get the message out. And I still think we need to get the message out should Wigan come out of restrictions, because it's not gone away, as Richard says. It is still there, and it is still something that we have to be very vigilant on. And we really push that message home in Wigan, and it's certainly making a difference. And we're seeing through the figures that we're seeing here today that the Wigan story has been consistent in terms of the level. And I think it's only right now that we move out of restrictions if the government allow us to.
Thanks, David. No further questions. I don't know if any of the other leaders wanted to come in for any final thoughts. If not, we will just finish.
Ross, shall I just say very briefly, just to, if I can, thank everyone as ever for joining. I would really want to thank everybody, though, who's working in our districts and across Greater Manchester. As you can see, we've been through a really difficult time these last couple of weeks, but there's been a huge amount of work going on, and actually Greater Manchester has been pulling together, as it always does, to provide support. So while it's Oldham now, it may well be another borough with the greatest challenge soon, and of course we'll support them in exactly the same way. The letter will be about to go to the government this afternoon, setting out the position as we've outlined to you today. Just to reiterate, we want an open conversation with the government about this and to come to an agreement. Imposing measures on less affluent communities at a time like this without any consultation is a very difficult and wrong thing to do. And we hope the government will understand that and work with us to get things right for Greater Manchester. We think we know what's right for Greater Manchester. We've outlined it today, and very much hope the government will accept what we've said. So thank you everybody for joining. We will have another emergency committee meeting next Wednesday to keep on top of the situation, and of course we'll therefore have a press briefing next Wednesday afternoon. So we will see you all again next week.